Welcome, everyone. We will be starting promptly at 2 p.m. Thanks for joining.
Hello, it's 2 p.m. So we're going to get started. Welcome to the Housing and Services Resource Center's webinar, Making the Case for Accessibility, Strategies for Sustaining Cross-Sector Collaborations. You're going to learn a lot from our presenters, and we built in a variety of opportunities for you to be an active participant. Thank you so much for joining us. My name is Charlene Allen, and I am a senior management analyst in the Office for Interagency Innovations at the Administration for Community Living, which is an operating division within the U.S. Department of Health and Human Services. I will be serving as the facilitator for today's webinar. It is a privilege to have so many of you here with us. Your active involvement in the webinar is essential for us to have an engaging discussion. So let's get started. All right, first, there are a few housekeeping items we want to address. This meeting is being recorded. By staying to participate, you are consenting to the recording. Also, all attendees have been muted for audio quality. One hallmark of our webinars is active participation from attendees. Please frequently use the chat to make comments and submit your questions at any time in the Q&A feature in the Zoom dashboard. Or you may email a question or comment to hsrc@acl.hhs.gov. We have a very full agenda, but have reserved some time to address your questions at the end. You can also use the chat or email if you have a technical issue or a comment for other attendees. Finally, near the end of the webinar, we will be using both QR codes on the screen and links in the chat to share some resources. So consider having your smartphone handy. After the webinar, we will email the slides and links to everyone. Today, an ASL interpreter will be visible throughout the webinar. You can enlarge the window of the ASL interpreter by using the pin feature. Simply click on the ASL interpreter's window and select the pin icon to make their window larger. To ensure that ASL interpreters will be visible in our webinar recording, we have also asked presenters and panelists to limit the use of their own camera visibility only to when they are speaking. For those who are using a screen reader and want to silence unwanted chatter in the chat and Q&A boxes, activate the speech on demand feature by pressing insert space bar and then pressing the letter S on the keyboard. So while we get started, first, we would appreciate your participation in a quick poll so that we can better understand who has joined us today. Please let us know what types of partnerships you have to support the home accessibility and housing stability. If you have more than one type of partnership, please select the option that best describes your partnerships. So the poll questions are: we partner with aging organizations. We partner with disability organizations. We partner with housing organizations. We partner with health organizations. And then none if you're here to learn more about building partnerships but haven't gotten started yet. Please select the best answer out of the 4 We know that in some cases you may have more than one type of partnership ongoing, but please select the best option. So we will take a look at the results in a few minutes after everyone has had a chance to take the poll. While you are responding to the poll, I'd like to tell you about the Housing and Services Resource Center, also known as the HSRC, which was launched in partnership between the U.S. Departments of Health and Human Services and Housing and Urban Development. The HSRC fosters cross-sector partnerships between the organizations and systems that provide housing resources and homelessness services, healthcare and mental health services, independent living services, and other supportive services. The HSRC is part of an interagency initiative to streamline and expand access to affordable, accessible housing and the critical services that make community living possible. After the webinar, I hope you will take a look at the HSRC website at acl.gov/housing and services. At the end of the webinar, we will share our email address so you can be in touch with us and get periodic updates. Now let's take a look at our agenda for today. To start, we will briefly discuss the importance of sustaining partnerships to promote accessibility and housing stability, and I'll share a few statistics. Then Emily Neighbors will introduce our 2 new action guides for cross-sector collaboration and will highlight content in the guides on sustainability strategies. And then later, we will hear from 2 groups featured in the action guides. First, the Orange County Home Preservation Coalition will give us a firsthand look at how they have built and sustained their partnerships and activities. We are also very excited to hear from the Green and Healthy Homes Initiative, who will discuss how you can use data to demonstrate the impact of your work to fund and expand your services. And we will have just a small window available for questions before we close, so please be sure to submit your questions early in the Q&A, not in the chat. That way we will be able to identify potential questions for our presenters. All right, so please close the poll. And while we are taking in the poll results, I want to remind everyone to please use the chat and the Q&A functions throughout the webinar. We're very eager to receive your comments and questions. Okay, let's take a look at the poll results. It looks like the largest share, 34%, already partner with disability organizations, and 24% partner with housing organizations, 20% partner with aging organizations, and a smaller number partner with health organizations. And then we've got a pretty good chunk, 15%, that are here to learn more about building partnerships. Okay, that's great. Thank you. All right, so one other thing, if you can add in the chat something that elaborates a little bit more on how you, the ones who said that they already have partnerships, how you use those partnerships to support your aging, disability, health, and housing service delivery. Because I think your fellow attendees would benefit from having that information in the chat so they can understand as well. So in terms of the role of accessibility and housing stability, having an accessible home is important for several reasons. Increasing accessibility in the home creates increased stability and decreases the possibility of becoming unhoused or having to enter an institution. Some accessibility solutions may already be available in your service area. We're going to tell you about those programs and how you might go about creating partnerships and accessing these solutions to increase housing stability for your consumers. But before we hear from our presenters, I just wanted to share a few statistics regarding the affordable and accessible housing crisis. There are over 23 million American households with home accessibility needs. We also know that in about 40% of the households in the country, a person is living there that does not have the accessibility features that they need to live safely and successfully in the community. In almost half of our homes, the residents have to use stairs to enter and exit. And just 14% of households that include people with accessibility needs report that they have a ramp, lift, or other solution to assist with safely getting in and out of the home. Next slide, please. So some accessibility solutions may already be available in your service area. We're going to share information about these programs and how you might go about creating partnerships to accessing these solutions to increase housing stability for the people we serve. So now I'm going to hand it over to Emily Neighbors. Emily is program manager at the University of Southern California Leonard Davis School of Gerontology. She's going to tell us about our 2 new Housing and Services Resource Center action guides for professionals. Okay, over to you, Emily.
Great, thanks, Charlene. Home modification service delivery goes beyond just installing modifications, as many of you may know. There's a process that involves intake, assessment, finding funding, and follow-up. There can be challenges as well in this complex process, working with limited funding, reaching the people who really need services, and meeting often complex health and housing needs. Partnerships across the housing, disability, aging, and health sectors can help organizations overcome these challenges. Next slide. Our team at USC had the pleasure of contributing to 2 action guides that have just been released by the Housing and Services Resource Center. They are available on the HSRC website, on the accessibility page, and the What's New page. We'll be sharing those links in the chat, and we'll also share the HSRC website again at the end of the webinar. We want to give an overview of the action guides first. They are ACL supported efforts, or Administration for Community Living supported efforts, to advance home modifications and assistive technology. They are designed to support the efforts of aging, disability, health, housing, and community-based organizations. Action Guide 1 provides tools for building cross-sector partnerships. It includes potential partners, data sources to demonstrate the need, collaborative activity examples, and how-to tips. Action Guide 2 focuses on approaches for building partnerships with the housing sector in particular. It includes step-by-step instructions and examples of partnerships for improved service delivery. Let's take a closer look at each one of the action guides. Next slide. So focusing on the first one, the power of cross-sector partnerships to advance home modifications. It provides tools for building cross-sector partnerships and offers comprehensive steps and guidelines on how to find potential partners, how to approach them, how to create agreements, and plan collaborative activities. It also includes health, housing, disability, and aging data sources. And you can use this information to explain the need in your community to new partners and funders. Next slide. The second action guide is partnering to expand access to home modifications, repairs, and weatherization for community living. This second action guide provides tips on building partnerships with the housing sector for home modifications and repairs. Why did we focus on partnerships with housing organizations? Well, these partnerships can offer access to specialized funding sources and expertise. They can contribute a housing perspective to your service delivery, and they can foster champions within the housing sector who can build awareness and engagement around community living among their peers. This action guide explains how to approach potential housing partners and create a plan with them for collaborative activity. It includes types of collaborative activities to increase access to home modifications, repairs, and weatherization services. Some examples include ways to educate consumers, engage volunteers, and streamline access to services. This action guide also features examples of such partnerships across the country and where to find more information to support your efforts. Next slide. In addition to building partnerships, these action guides offer tips on how to sustain partnerships as well. These sustainability strategies include securing commitment from partner agency leaders, using data to demonstrate the need for services, integrating activities and personnel into existing agency budgets and operations to sustain those activities, using data to demonstrate your services' impact on health, and identifying funding and in-kind resources to braid or leverage to support your activities. Next up, we're going to hear about how these strategies can work in real-world situations. So Charlene, I'll pass it back to you.
Charlene, you're on mute.
Sorry, I was muted. I didn't mute myself. Sorry about that. Thank you, Emily, for that introduction. So now we're going to hear from two programs featured in the action guides. First, it is my distinct pleasure to welcome Dr. Ryan LaValle and Leah Edmonds. Dr. LaValle is a founding member of the Orange County Home Preservation Coalition in Orange County, North Carolina. He is the primary lead of the UNC Department of Health Sciences Community Practice Lab and director of UNC's Partnership in Aging program. Leah Edmonds is a PhD student in the geography department at UNC Chapel Hill with a research focus on geographies of urban aging. She leads the Community Practice Lab's housing team, supporting the coordination of the Orange County Home Preservation Coalition and Orange County Affordable Housing Coalition. All right, Ryan and Leah, the floor is yours.
Hello, everyone. We're very excited to be here to share this example and some of the work that we've been doing since about 2017 in the Orange County Home Preservation Coalition. As Charlene mentioned, I'm here at the University of North Carolina at Chapel Hill. I'm also a community occupational therapist, which means I don't really work through the health system. I do a lot more of sort of community level thinking around access and accessibility. I'm excited to talk with you a little bit about our work around the Orange County Home Preservation Coalition, an initiative that was actually born out of the Orange County Department on Aging and aging sort of initiatives across the county. So next slide, please. So the first point that I want to make is that the work that we're presenting today is really rooted in partnership. Lots of committed partners have really come together and talked and discussed how this work can really move forward in a way that's effective for multiple sectors, and has really thought through the different iterations of how this coalition has evolved. And we'll talk a little bit more about that. Some of our main partners are Rebuilding Together of the Triangle, Habitat for Humanity of Orange County Department on Aging, and the Orange County Housing Department. So local government and housing agencies have been really big partners in considering how this coalition has developed. As well as just recognizing that as we developed the coalition, other organizations wanted to join and saw it as a really exciting opportunity. And so we see a lot more individuals and organizations coming to the table. Next slide, please. So the history of this coalition is, again, rooted in the aging sort of work that happens here in Orange County through the Department on Aging. We have a master aging plan that is developed every 5 years. It's a pretty robust community-led initiative across the county, across multiple sectors to develop a strategic plan. And in 2017, as a community occupational therapist, I was working with older adults in their homes, and we were hearing a lot of feedback around lack of accessibility to modifications and home repairs. And so as part of this master aging plan process, we brought together all of the sort of stakeholders within that realm within our county to discuss how we could actually increase access for various individuals to be able to access more modifications and home repairs. And through that meeting, the different partners really enjoyed it and loved connecting with each other and being able to talk through even specific cases and homes that they were all familiar with. And so they wanted to continue meeting. And I so happened to be given the opportunity to lead and coordinate those meetings from that point forward. And so have been the coordinator since then with a variety of different partners and students support and other support throughout. Just to give you a sense, in 2018, we were sort of trying to bring this coalition together. And we did see some bumps along the road. There were certain partners who weren't exactly on board with the coalition process or some of the tools that we were trying to use. And so we did have to think through how we could really approach each partner differently and recognize the readiness of the different partners. But just to say, it doesn't always start and everything goes well. You do have to sometimes think through some of the challenges that might arise. In 2019, because we were already working on this collaboration, we were able to get a large Southeastern Energy Efficiency Alliance grant that actually was focused not on actually providing home repairs and modifications, but actually building infrastructure for our coalition to increase access to weatherization and climate action repairs. But we sort of used it to develop the coalition overall for all home repairs. And so for 2 years, we developed 5 different tools that really focused on helping us collaborate together. In 2021, we did our first program evaluation, and we used that data to really morph the coalition again. And so we've been working under that evolution since about 2021. And then in 2023, we've done a second program evaluation that has also revealed some changes that need to happen in our coalition. And we'll talk a little bit about that as we move forward. So we're continuing to evolve and developing structures and processes, but I also wanted to show this timeline to just demonstrate how long sometimes partnership takes to build these coalitions. Next slide, please. So this is the model. On the screen, there's a model that has lots of different moving pieces and shows sort of how we envision the work that we do as a coalition. On the left, you see an Orange County homeowner. Previously, that homeowner was like a ping pong ball, sort of bouncing between different organizations and applying to lots of different places to just see who could serve them at any time. And so what we've done is really tried to pull them out of that process and some of the burden of doing that navigation and tried to streamline that. And so that homeowner now fills out a unified screening tool. That screening tool is given to a home assessment manager who goes out to the home, actually does a comprehensive assessment of the home for the entire coalition, brings that back, and is then that information is put into a shared database that all of the different organizations that you see, like Habitat for Humanity, Rebuilding Together of the Triangle, they have access to see what are the types of home modifications and repairs that this particular home needs for a comprehensive home repair. So that home assessment manager isn't just looking at what their organization can provide, but really thinking broadly across all the organizations as to what anybody could potentially provide, and naming all of the different repairs or modifications that this person might actually need. And that is then in conversation with us in regular monthly meetings that the town of Chapel Hill, the town of Carrboro, the different local municipalities are actually involved in, and can hear how some of the funding that they're providing for home modifications for low-income families are actually being used, and some of the challenges that we might have in using their funds. And all of this is really coordinated and supported by the different coordinating members of the coalition. Me as the coordinator, but also with other team members that are now evolving as the coalition has grown and changed over the years. So that's just an overview of sort of the model. There's a lot of these pieces and different tools that we use and have developed, particularly the unified screening tool, and the database has had multiple iterations over the years to really make that the most accessible as possible. So next slide, please. And so as we think about, since 2017, there's been lots of lessons learned about this coalition process. It's been really exciting and really telling to see the commitment that a lot of the partners have had. Most of our partners who started with us have stayed that whole time. Now, we've had people change within those partners, but the organizations have stayed the same throughout. But that consistent commitment to the coalition and to partnership has been a really big support for our success and allowed us to build continuity within the coalition. We also use what we call an abundance mindset, which is largely developed from a partner named the Marion Cheek Jackson Center. And they have really helped us to name understanding sort of the non-competitive side of this work. Many of these organizations might be trying to get the same funding, tried to really compete with each other for these different resources. And our mindset is to really think about coalition and partnership in a way that does not sort of facilitate that competition among the organizations. There's enough work to go around, and reminding us of that is our database, which we'll talk about in a little bit. But our wait list says there's abundance in the work, and we don't need to be competing amongst the coalition. At the same time, as the coalition participates, we see a need for regular individual check-ins. So myself or Leah or other coordinators have gone to individual organizations to see, hey, how are you feeling about the coalition? What's working? What's not working? How can we make those changes? And we found that to be a really important part of keeping the coalition together and moving together as one unit. And in those veins, as well as in our regular meetings, listening very intentionally about how we're hearing partners engage with both homeowners and other coalition partners has been a really important part of our role as the coordinators, making sure things are moving. And then finally, thinking about accessible technology as a tool is a really important part of this. As an OT, I do think about sort of universal design and accessibility. But when we're thinking about the actual database and how our partners are accessing information, we want to make that as available as possible and clear as possible, or else people get really overwhelmed by the data and the database. And so thinking about how people access partnership is also part of this in a lot of ways. And then readiness. My philosophy is that I do not chase after people to be in the coalition. Most of the partners and the committed people that we have seen have wanted to be a part of the coalition as we develop that. And so we don't have capacity to go out and really pull and chase people to be a part of it. But we do try and maintain the partners that we have and welcome new people who are enthusiastic about the partnership. So finally, some of the challenges that we face, staff turnover in organizations has been really challenging. There's about, I think, 2 or 3 of us that have been here since 2017, and almost everybody else was not here, and we've seen turnover happen. And so reteaching the approach, reteaching things like that has been a really big challenge. We also have a huge demand like everyone else, and meeting that demand is just not possible right now. We also have lots of different jurisdictions and eligibility criteria and systems to get funding, and that creates a lot of challenge as well. Among our partners, sometimes we have different organizations with different priorities and how they want to go about doing the work. For example, one organization might want to prioritize comprehensiveness, while others might want to prioritize speed of provision. And so these types of things we have to work out with as an organization. And each of those organizations sometimes have different processes, and whether they're using AMI or federal poverty limit or how applications come through. And so recognizing that those things have to be talked through and managed as part of the coalition is really important. Next slide, please. And so Leah is going to talk a little bit about how we've used that database and data as part of our process.
Yeah, thanks, Ryan. So as a coalition, I think what's really important to some of this work is it not just convenes partners for our regular meetings and bringing people together, but it is also a shared data system, a shared space for data learning and improvement. We use Airtable as our online database, which all of our partners have access to. And as the coalition has evolved, so has the database, as Ryan mentioned. Currently, as it stands, there are three main areas I wanted to highlight of how we're using data to continue to improve our work as a coalition. And so the first is problem solving. When a partner goes out to a homeowner's house and they say, oh, you know, another partner organization replaced the deck. Can you tell me who that was? We actually have a system where it's pretty easy for that person speaking with a homeowner to go back in and check and be able to have the up-to-date information to track how that homeowner's moved through a system. So it's clear for our homeowner to know how they're moving through. Similarly, on our internal side, we're always looking to improve. And when we say, oh, I think there's been generally surges in HVAC requests before the winter, before the summer, we can dive into our database and see what do we expect as our increased amounts. So we could plan out for the future, how we might better prioritize HVAC repairs ahead of the hot and cold months. We also use our database really to inspire engagement. For some of our partners, just having access to the database is a part of what brings them to the table. They're interested in seeing our data, the data that the coalition has collected over years, and having, as you can see on the right-hand side, these different reports that can be pulled out so they can look through and understand how we're addressing racial equity goals, who's being served in what areas. And we also regularly report on what that looks like. So being able to say, which partners are serving more families? Which areas of the county are we seeing more demands for housing repairs? So it's that real-time learning, and it sort of inspires more partners to want to come to the table and be engaged. And then finally, building on that, thinking about the advocacy that the coalition is a part of. As we sit kind of within other coalitions, the Affordable Housing Coalition for the county, the Master Aging Plan for the county, our data system allows us to feed back real-time information to what we're seeing on the ground, where we're seeing increasing need for home repairs, where we understand and can bring more evidence to the conversation about issues of unaffordability and housing precarity that's going on in our county. We can really kind of bring to bear a bit more of that evidence. So when our different partners want to say, like, this isn't anecdotal, this isn't, you know, by accident something's happening, our database can easily kind of pull up the evidence for that work. Next slide, please. And so the other piece I wanted to highlight is around the role of evaluation. As Ryan mentioned, we've done 2 evaluations. We do this work for both internal and external accountability. Being able to report back to the community, to homeowners, is so important to just the mission of this work, and being able to share how progress is made and how we're trying to continuously improve the coalition's home repairs process. And then similarly, internally, we want to get that insight back to our partners to help brainstorm how we continue to evolve as a group. And so when we do evaluations, it's a multi-method approach. We do interviews with homeowners, interviews with coalition partners, and then we also do those deep dives into our database. And so at the bottom of this slide, you can see this timeline that I've pulled out. And here from our 2023 evaluation, as one example, we're able to kind of track, well, what's the average time from when a homeowner puts in their screening application to when they complete their screening, to when they complete all of the home repairs. And so what we found in this last evaluation is that it's taking almost up to 2 years for a homeowner to move through our coalition right now. As our coalition has become better known, there is increasing demand, and there is a need for us to take this data now in our kind of 2024 work that we're planning out to think through actually how we can better address this wait time and the ways that we can better communicate with homeowners about just the sheer amount of demand and time that we are seeing for our county. And Ryan will speak more to that next.
So I'm going to be very brief and just say this is continually evolving. We're adding a coordination crew that is really diving into that case management and structuring the database in ways that help move people really through the pipeline in a lot easier of a way. And we're still figuring out what exactly that looks like. So thank you all so much for listening and seeing sort of our example. You're welcome to reach out if you head to the next slide to us. And if you want to learn more, go in more detail. So thank you all very much.
All righty. Hey, thank you, Ryan and Leah. That was wonderful. I would now like to introduce our next presenter, Ruth Ann Norton, President and CEO of the Green and Healthy Homes Initiative, a nonprofit organization that works to advance racial and health equity and opportunity through healthy housing. She directs their work across the U.S., where communities and states are using housing as a platform to improve health and social outcomes. All right, I'm going to hand it over to you now, Ruth Ann.
Thank you so much, and how great it was to, am I operating my own slides or are you doing that? Sorry.
You can tell us when you want to move to the next slide.
That's great, thanks. I am so thrilled to follow two good UNC folks as a UNC graduate. I'm calling today from New York City and happy to talk to you about our work in 3 locations around the country. If you go to the next slide, that we are working on. As in the introduction, and thank you for that kind introduction, we are an organization founded in 1986 by 9 parents whose children were poisoned by lead severely in Baltimore, and who opened a pathway for us to work on issues to break the link between unhealthy housing and unhealthy families. Over the past 30 plus years, we have endeavored to align, grade, and coordinate resources to create healthy, safe, and energy efficient housing for our most vulnerable children and seniors, with an emphasis on heavily and historically disinvested neighborhoods. We do work in both rental housing and homeowner housing. And so, sorry for the feedback. I'm going to try to be a little closer to the mic. But if you go to the next slide, I would appreciate it. So our model at GHHI to address those ills in housing that cause ill health is to align, grade, and coordinate resources from government, federal, state, and local government, philanthropy, utilities, and healthcare. Our work also leads us as a high trust audit agency to coordinate work around the country of other organizations serving as a bridge between funders and especially healthcare funders and community. But in 10 cities around the country, we perform direct services ourselves to create holistically healthy housing for disabled individuals, for seniors, or children. And we apologize for the sound. I'm seeing that. I'm sorry about that. And our approach is to use cross-trained workers to really diagnose both the health of residents and the health of housing and bring that clinical and evidence-based approach to creating healthy, safe, and energy efficient homes. If you go to the next slide. So we have a number of things that you heard in the previous presenter that I thought were so important around housing stability and home safety. And it's why we focus a lot on trip and fall prevention, aging in place, and other injury prevention measures as part of our overarching work in climate, health, and housing. We have so much to do on improving accessibility and quality of life and preventing injury. It has one of the highest rates of return on healthcare savings, but it also has so much to do with the quality of life so that people can age with dignity and health. But one of the reasons we're also doing this is we're working to close the 8-to-1 gap between the Black community and white community on intergenerational wealth transfer, sorry, I'm getting messages here, on intergenerational wealth transfer, on the ability to save health costs and reinvest in the home. But also, we got into the work on older adults because we wanted to also preserve that opportunity for intergenerational relationships and where grandparents could be present for children. But we do know that as we've done this work, our data has shown an enormously improved progress on closing appraisal gaps, on improving housing stability, and actually on improving health and longevity of residents. So it's an important part for us to look at in this work. Can you go to the next slide? So let me focus on 3 areas that we're going to talk about today. One also in North Carolina, where we served as a hub for the social determinant of health delivery services on behalf of Blue Cross Blue Shield of North Carolina, looking at how we could build a hub of service providers throughout the state to overcome barriers between the sectors, saving not only time and money for partners, but to incentivize investment from healthcare into social determinants of health to create healthy housing. In this work, we are working with disabled individuals, people post-surgery, as well as older adults. And we're able to do a coordination of data sharing so that we can align, grade, and coordinate those resources from healthcare and other resources while ensuring proper health care privacy. We have a coordinated referral process so that we are ensuring that the best contractor and the best work is being done to address the health issues and for long-term outcomes. And we draft and hold contracts between partners so that those partners can receive the resources of the healthcare entity and other entities and be able to address not worry about the funding, but the outcome and the evidence base. And then we take that data and we assess that data, the health patient data for those outcomes, for the health savings, and for models for not only Blue Cross, but other healthcare providers on how they can reinvest in healthy housing. So if you want to go to the next slide. And I want to say we've done this for both MCOs around the country, state health departments, Medicaid, and hospitals. But in the North Carolina program, it is a referral process coming from the healthcare referral system where we then do the intake across all of those intakes for the state and look at the eligibility and look at the steady stay independent risk screening. And then based on that initial intake with the client and the healthcare provider, we're assigning to the service providers. And in the model in North Carolina, we worked in 6 areas: Wake, Durham, Orange, Guilford, Forsyth, and other areas. In We did that based on data so that we could build the demonstration and evidence for long-term investment, looking at different communities, different housing stock, both rural and more urban settings. The approach is really taking an education, a home's fall risk assessment, working to do a comprehensive assessment in the home. In our normal holistic housing programs in our 10 direct service sites, that includes climate measures, asthma, lead, injury, weatherization, and home repair. In this, we were looking really around the risk assessment for falls. From that, building a scope of work, building out the education plan, and we do share this, all of our assessment tools publicly, I should say. And then we have a follow-up plan of 3 follow-ups to build out the quality control, satisfaction surveys, checking on the quality of work, and checking on the long-term outcomes at 3 and 6 months. And in our larger programs, that's 3, 6, 9, and 12. But you want to go to the next slide. So some of our performance indicators that we're looking at are the implementation metrics, right? The referrals and home assessment repairs, the self-reported falls under quality of life metrics, the medical utilization and expense metrics, and the experience metrics. What we care about the quality of this work and the quality of the outcomes, but we also want to know how people are experiencing that, how likely they are to stay with a health plan because of the services offered, and how likely they might be to refer it to others so that we can prevent injury, we can improve long-term stability in this program. This is in an evaluation period right now, and come later in the spring, there'll be the publication of that evaluation for decisions by the healthcare plan as to the permanency of the program. If you want to, but the important, I think, linkage here is bringing those healthcare dollars in along with dollars that we typically see from HUD or state housing programs or state health programs or even aging or philanthropy. So if you want to go to the next slide. So we're also looking at the total cost of care in the stay, looking at the 2 years after a significant fall, as we look at things, our program in Tennessee with Habitat for Humanity, again, an intersection with the program that you heard about from Orange County and Chapel Hill. Habitat has a lot of work in this around the country. And in Tennessee, we're taking Medicaid claims data in Shelby County. We're able to look at those 5 years of claims that have totaled $3 billion for having 800 members a year having a fall incident and 2,400 members a year ending up in the ED. So what we're doing in the Habitat program and in our older adults program that's supported by HUD is we're looking at those measures on the fall and injury prevention and its outcome for the Tennessee healthcare system and for other healthcare systems, Medicaid, managed care, and Medicaid and Medicare. But we've clearly seen that in doing this work, we've had dramatic reductions in emergency visits, hospitalizations, and injury. If you want to go to the next slide here. So the savings from avoiding the nursing home, right? On the data side, equating really to reducing significantly these costs that you see that can run as much as $85,000 to $90,000 for being in a nursing home facility, where we can make investments that are sometimes around $1,000, $1,500 to $20,000 investments, and over time we are looking at paying for that very quickly, clearly within the first year, and being able, as I said, to improve the value of the house, to improve the ability for people to live with quality and health, and improving the opportunity for that intergenerational wealth transfer. We often are seeing people who are living with that choice of not being able to hold on to their home, hold on to their quality of life, to their community and actions, and being able to, and having to move, whether they're disabled or older. This is a challenge that we're facing. If you want to go to the next. In Baltimore, we run what has received it's a HUD Secretary's Award for Best Practice, the Housing Upgrade Benefits to Seniors, and we co-lead that with a group called Civic Works. It's funded by the Weinberg and Stallman Foundations and the Hofberger Foundations. It's also funded by the Affordable Housing Trust and other dollars coming in from health and housing. We serve as part of a leadership team, but we have a very large practice of partners throughout the city, from aging organizations to housing organizations, to those who are also connecting food and healthy housing through Meals on Wheels. So we have a pretty holistic approach here, again, looking comprehensively, except for in this program, we are applying that whole house holistic set of measures, the weatherization, the respiratory trigger reduction, lead, and other energy efficiency, and even now decarbonization and electrification, working together to build that higher longevity in housing and higher wealth building. If you want to go to the next slide. So the challenge hubs is addressing is the population in Baltimore, 60 plus, is on the upswing and expected to increase by 24% over the next 3 decades. A quarter of the homes, occupied homes, are owned by older adults, and most of those adults are low wealth adults. 17% of all older adults in Baltimore live below the poverty line, and so are living on a day-to-day risk of losing their home. So we're looking at fixed income and how do we help in disinvested neighborhoods build that wealth back. So we, in this screening tool, we're looking at that economic frame as well as the health frame and those measures on an evidence base to move that as a social driver and social determinant. So if you want to go to the next slide. So we've had a number of hundreds and hundreds of homes that we have done through the Hubs program. In fact, the collective is in thousands. But what we are looking at, as you can see here, is that significant investment on HVAC, weatherization, everything from how do we move people off of gas that is also unhealthy onto electrification, and how do we build the mechanisms for them to better afford their housing, lower their maintenance. And I know I'm getting toward the end of time here if you want to go. All of this is all data driven. We use an efforts to outcome system to track that data shared between all of the organizations so that we can make strategic decisions and improve lives like we see here for Corliss Billups, who was on the edge of homelessness, did not have any operating heat in her home, had plumbing leaks, could not take a shower in her home, had to live on the 3rd floor to even try to stay warm, and was about to leave her home for publicly supported housing. And we were able to bring this approach. And today she's got significantly lower bills. She's living in a healthier environment that she can bring her grandchildren, and I think is the proof and the reason that we do this work, because she's able to live her life out with better quality and building wealth for the next generation.
I love that example, Ruth Ann. We're getting very close to time. So is there anything
here? Yeah, I just
okay, great.
Say,
Thank you.
This is absolutely just showing people the various interventions that we do and what those needs are in this program. But we can move on to questions, please.
Okay. All right. Wow, that was another excellent presentation. And that is just a lot of great information from all of our speakers. Thank you very much. So I'm going to pull a couple questions from the Q&A. I think there's one that was repeated by multiple people that can be addressed by all three panelists, and that is, what database do you use? How did you select it? And was there any consideration to how the choice of database would interact with your partners and your partnerships?
We use an efforts to outcomes database that we've been able to customize to both the housing intervention side and being able to track cost and hours and efforts, right? But the reason we chose it is because we could dually track that healthcare side, the health outcomes. We can and be able to measure where dollars are going from an equity perspective, able to mapping that out. So the multifaceted way that that could work, and it's a database that can lay on top of everyone else's database so that they can upload data without having to change some of the systems that they're using.
And we sort of opportunistically use Airtable, I would say. Airtable is the software, but there's lots of other different types of relational database softwares. This one was being used around us at the time when we started. And so we sort of started with it and have continued with it. The thing I do like about this one is that it does focus on usability for people who are not super tech savvy. And it doesn't really require someone to have sort of a background in database development or coding to be able to really engage with it and build how it sort of moves through. So we don't necessarily have to hire anyone, but I have learned a lot about building databases. And so things like Salesforce or Acorn are other options that you might be able to use to do sort of what we do. But that just happens to be the one that we started with.
I think we had a similar kind of approach on that to make it easy, but also to be able to capture the comprehensive nature of the tool that we use on the front end. And I think we both use comprehensive assessment tools. Ours was developed in partnership with CDC and HUD to look at these programs, and we've built off of that. And so we chose ETO because we thought it was a very effortless lay on to other organizations to come into.
Okay, great. So one more question I'm going to single out, and then any of you can answer this. Are there any challenges when you're doing a home modification when someone is a renter versus someone who owns the home that they're in?
So this is, I think, a really big gap in a lot of housing and home repair services in general. We don't have a good solution for renters, full renters. We also have an issue of people who own their mobile homes but don't own the land on which that mobile home sits. That also excludes them from a lot of federal funding and state funding options. And so there's sort of a spectrum there of rental, but full rentals are, because it's really the landlord's responsibility to maintain that quality. We have some organizations that can go into like an agreement where the landlord signs off on the modifications, but many of our organizations don't want to be responsible for coming back and removing that modification if the person decides to leave and sort of maintain that responsibility in the long run. We've thought about some waivers and that sort of thing, but that again creates some complications. So renters is a place that we haven't really been able to crack the nut when it comes to for our area serving well.
It's a little mixed depending on the location, but in our Baltimore program, we provide legal services, and we also are pretty experienced at working with renters and homeowners having come out of the lead paint abatement field. So we have about a 50-50 mix of how we serve clients there. A lot of our older adults work, though, is focused on older homeowners for reasons of really wanting to build housing stability. But we wrap around both the economic benefits to the owner, as well as the enforcement of housing codes and regulations on rental housing in the jurisdictions where we do rental, and then provide legal services for the tenant as ways and means to ensure that we can get those measures accomplished.
Okay, great. All right. Well, we had a few other questions, but I think we are at time close to being at the end. So I want to thank all the presenters for sharing their important work. And I hope the audience learned as much as I did. It was a fantastic webinar. Before we close, I want to remind everyone that in the coming days, we'll be posting a recording of this webinar and the slides on the HSRC website. In the meantime, please visit our website, check it out. There's a lot of great resources there. And there's also a lot of great resources that have been put in the chat for you that we hope you take advantage of. So I also want to ask you to take 3 minutes to answer our short feedback form, which has been put in the chat. There's just 5 questions, and we want you to rate different aspects of the webinar and also tell us a little bit more about the future partnerships you're considering. Again, the HSRC is your resource center. We want you to feel to be part of the team and to have ownership in the resource center. And if you want to email us at hsrc@acl.hhs.gov about technical assistance needs, website suggestions, and maybe to tell us about your own partnerships, we'd love to hear from you. Finally, I'd like to thank the team that helped put this together, the New Additions Consulting, US Aging, the USC Leonard Davis School of Gerontology, One Source Events, our excellent ASL interpreters and CART specialists for their roles in producing today's webinar. And we're especially grateful to all of you who joined us today. So thank you and have a great afternoon.